In this video, I'm again discussing a recall important communication. It's really famous. It comes on exam. That is headache. Headache that mom wanted the brain scan, but history of tension headache, explaining why not necessary and referral to headache clinic. Another is tension headache explained to the father for a 10 years old boy. Another scenario of a 15-year-old who had been previously and diagnosed with tension headache, but your consultant and has some come back for discussion and follow up. The patient had some alone, come alone. Okay, talked through the diagnosis of tension headache, no need for further investigations, no underlying serious cause. Then talked through home, school, and social life to try to identify and stressors, but she was not too forthcoming. Forthcoming. Okay, patient said that she did not feel stressed and that parents did not seem to care. Offered to talk to mom independently or together and to school. Talked about not using painkillers all the time. Offered referral to psychology, which she said she would think about. Feedback not clear pass, as did not discuss confidentiality and did not talk about the stress relieving method. So everything we need to discuss. It is very important. It comes with father role player, mother role player, and a teenager. So lots of question we need to discuss. Plus, why we are not offering brain MRI? Any, it is not brain cancer. We need to tell. As usual, we are started like that. Introduce myself. I am CAP Repo. Taking the concept. It is a perfect time for you and agenda. I will tell attendance and the prior knowledge. Hello, Mrs. Suppose hello, Mrs. Sarah. Hello, doctor. I'm Dr. Emma, one of the doctors here. I guess you are Alice Mame, isn't it? Yes, doctor. Is it? It is my honor to sit with a keen mom like you. Thank you, doctor. I'm here to talk to you about Ali's headache. First, would you like anyone to be here, or shall I start? We can start, doctor. Tell me, how can I help you? That Ali he is having this headache and increasing in its frequency, severity, and I'm terribly sorry about him. And I want to do a CT for her. Oh, I can understand your feelings. Tell me why you want to do a CT. So, Louis, we asked that why you want to do that. Is there any hidden agenda? Because it is increasing, doctor. I am so worried, and it may be a brain cancer. Oh, ma'am, I really understanding how do you feel, but let me reassure you that after examining him clinically, there is no sign of brain cancer. He is clinically fine, so no need for the CT. But still, I wanna do. Can you tell me why? Because no reasons. I'm just worried about him. Actually, she is having what we call tension headache. Did you hear about it before? So after that, we'll discuss starting about the tension headache. No, doctor. It is the way her body reacts to a stressful situation, as you have mentioned that have final exams after 2 weeks, isn't it? So tension headache is something that is the way of his body that reacts during stressful conditions. That's why it's nothing like brain cancer. So imaging is not needed. Yes, doctor. The headache is the way of her body react to the stress adding to the CT. It's very scary experience to the child adding to her stress and worsens her headache. Are you with me? Why it is stressful? Because it is a very big machine. He will be in and out many times. He has to still not moving at all. Adding to this is very high dose of radiation, and he doesn't need that. First of all, we tell that why you are not going to city. First of all, it is unnecessary. It has high radiations. He needs to many time in going in and out, and also it's really a scary experience as stress increase this tension headache. So again, we are giving her stress. Then okay, doctor, you can do MRI brain. Okay, I really admire your knowledge, mom. But actually, MRI brain there is no radiation, but it is very big machine and movement at all for 30 to 45 minutes. And some children need very sleeping medicine. So this is also a very stressful imaging to Ali and will add to her headache. Okay, doctor, what we gonna do? So MRI of the brain has no radiation, but 30 to 45 minutes, and it's really for child difficult. So they need sleeping medicines, and we are doing all this unnecessary. So what we will do? Them we'll give him painkiller. I already give him painkiller, but it is not working. Maybe we have a meeting with the doctor who deal with what is called cognitive behavioral therapy, which means that he will teach him healthy way to express her stress. Are you with me? So we'll give cognitive behavior therapy. Give. I think you do this, but as we are from Middle East. No, actually, ma'am, we are treating all patients equally, regardless their ethnic group, gender, and religion. Someone telling that we are Arabian, we are someone Egyptian. That's why you are not treating. So we treat all patients equally. Nothing depend on like age, their ethnic group, religion. Nothing we consider equally treated. So, doctor, it will if you will not do, I will complain, ma'am. We are going to the best for her. I will complain. If this is what you wish, I will guide you through the patient advice and liaison service, but take care only if he has morning throwing, morning blurring of visions, nausea, or if that taken awaken him from the sleep at this time, we may consider doing for further investigation. So every communication I already told you at the end, we told that the warning or red flag sign. If find that, they will come. So tension headache, for headache, we know that morning throwing up, morning blurring of visions, nausea, or if the headache awaken him from the sleep. At this time, we may consider doing further investigation. So morning headache is the sign of brain tumor. And a summary website, leaflet, and support group. This is one of the that is with mother. In tension headache, we are explaining why we are not doing the CT scan or MRI. Now teenager, so teenager has lots of question. How can we deal with this communication? I asked the CAP as usual. Then I am here to inform you that after examining Ali and doing some tests, we found that he has what we call tension headache. Have you heard about this before? Explain. Some people under stress can feel a constant aches affecting both sides of the head, like a bend like. It seems squeezing the head and may feel neck muscle tighten and feeling pressure behind the eye. So stressful condition, it is a bend like in nature, pressing causes squeezing of the brain and causes headache. Yes, it is not real. No, it is a real ache, but I want to assure you that it is simple and very common and not severe to prevent daily activity. So it is simple, it is not that serious, so no need to be that much taking it seriously. But there is some warning sign to take care of. What are the warning signs? I told you that is if it is associated with neck stiffness, it is if with morning vomiting, confusion, if follow any trauma, there any weakness affect the speech or confusion or change in the behavior, increase by cough or straining. In this feature, it happens. Seek medical advice. So the red flag are neck stiffness, morning throwing up, morning vomiting, blurring of vision, confusion, speaking difficulty, following any trauma. These are changing in behavior, increase by cough and straining. Okay. So what caused this? The exact cause is not clear, but there is some triggering factor. So we told that some triggering factor, and she needs to try to avoid like stress, anxiety, tiredness, missing meal. Stress, anxiety, tiredness, missing meal, noise, and wrong posture. So stress, anxiety, tiredness, missing meal, wrong posture, he needs to avoid. How can we treat this? So it is not severe, easily relieved by painkiller or lifestyle changes like relaxation, yoga, exercise, and message. It is better to make a diary to identify the trigger. Avoid 4C. Remember that is caffeine, citrus, chocolate, and cheese. Caffeine, citrus, chocolate, and cheese. So identify the trigger, make a diary, take painkiller, avoid the trigger like missing meal, noise, anxiety, stress, also caffeine, citrus fruit, and then citrus fruit, caffeine, that is chocolate, cheese. These are. You mean a guy? I give my child caffeine. No, I'm not criticizing you, but some drinks and foods contain caffeine, and you may don't know. Behavioral therapy and relaxation exercise. So, behavioral therapy, relaxation exercise, proper sleep, yoga. These are. How can you know that it is a simple and need no imaging? By examining her and do some tests that is found normal, and we are not need imaging as. I have a neighbor who have headache like this and do imaging found brain tumor. Cases and condition are different from each other. So if this type telling that my neighbor has brain cancer, I'm really sorry for his condition. And cases and people are different and condition are different. These are we tell and support group leaflet website. These are we are giving. This is all about tension headache communication. Thank you.